I got a lot of great questions tonight, guys. They're actually mostly about eyes, to be honest. So that's no surprise. That's kind of interesting. Eyes are obviously so valuable. And a lot of people seem to be struggling with their eyeballs. So it's totally understandable. And red light therapy is very, very good for eyes. So we'll be tackling some of the questions around eyes tonight. So the first question I have here is, oh gosh, I've lost it already. Maria says, I have problems with sinus. Now, I don't know exactly what kind of problems with the sinus she has. If she's talking about just general inflammation in the nose, she's struggling to breathe, well, red light therapy is fantastic for that. The Target Light 2 is probably the easiest one to use. That's this little guy over here. You can just put that right on your face, right around your nose, on your cheeks. And the red light therapy will reduce the inflammation in your nose and increase the blood flow and help you breathe faster if that's the sinus problem she is referring to. And then, oh gosh, here's one. I fainted and hit my head on a doorpost 6 days ago. I had it checked in hospital and all is well except for concussion symptoms. Up till then, I'd been using the 670 lamp on my eyes each morning, but I stopped after the bang on my head. Is it safe to resume or should I wait a while? It's absolutely safe to resume. Red light therapy is fantastic for your brain and for your head, especially after you've had a little whack. It's absolutely the best thing to do. The only problem you might have actually is if you've only got the 670, unfortunately, red light doesn't go very deep. So for the brain, you need near infrared light. So you would need another device that has a near infrared light in it. You could shine it on the back of your head, at the top of your head, your forehead. All those places are good for the brain, even on the side of the skull like that. But you do need the near infrared light, unfortunately. I have the Target Light 2. How can I use it best to develop my vision? I can't see well when I read and probably have a bit of refraction error in one eye due to getting older. I use regular cheap reading glasses. Maybe that's not a good thing. Which program should I use for the best results? So when it comes to eyes, both red and near infrared light is fantastic for your eyes. So the most important thing with any of our devices anyway, I can't vouch for if you've got another company's device, but the most important thing is actually the distance, because the red light is so powerful. It's very, very strong. You don't want it to be right up in your face because that's too bright for your eyes. It's just like looking at any other bright light, the sun or car headlights, whatever else. Bright light is not good for your eyes. So with the red light therapy, all you got to do is hold it at arm's length away from you, which is roughly about 65 centimeters. And you can use the red light and the near infrared light together. Both of them are fantastic for eye health. And you should see a great improvement in your vision. So we've got, just today, I had a bunch of reviews come through on Trustpilot with people that have had fantastic results with their eyes. They're reducing their prescription. Their eye doctors are blown away. They've never seen anything like it before, and it's all down to the red light therapy. So it's not so much about which one you're using, whether you're using red or near infrared. I recommend both. Use them both together. It's just about that 65 centimeters away from you and 3 to 5 minutes a day. That's all you really need. Next question, what precautions should be taken when using red light on eyes? Again, it's just the distance is very, very important. So just make sure it's that arm's length away. You don't have to look directly into the light. You just need to gaze around the light. So right now you can tell there's some lights above me. I'm not looking at them, but there's light coming in my eyes. It's the same thing with red light therapy. You don't have to stare directly into the light. You just need to make sure you kind of gaze around the bulb, above the bulb, below it, and around it. The light goes in your eyes. That's perfect. You only need 3 to 5 minutes a day. You don't need any more than that, and more is not better when it comes to red light therapy. Do I remove contact lenses when using on eyes? Yes, it is recommended because the contact lenses is like just another filter for the light as it's going through your eyes. So if you're able to remove your contact lenses, do that. Definitely remove your glasses. Have yourself a quiet 3 to 5 minutes with a red light therapy on your face, in your eyes. It's fantastic. Another eye question. I have glaucoma. Would my light help? Yes, absolutely. It's not a miracle cure. I don't want anyone to think that, you can ignore your doctor, you can, forget everything else. But what it has been shown to do is actually slow down the progression of glaucoma. And in some cases, for some people, it can actually start to reverse it and help the eyes return back to normal function. We have a lot of great positive reviews with that, so it's absolutely fantastic for your eyes. And just if you are able to remember about the 65 centimeter distance, 3 to 5 minutes a day, that's all you need. We do have a guide that's freely available on our website where all this information is in, so you can check that out. And the same person is saying, I have sciatica and diabetes. Okay, and she says she has the small light. So we have 2 small lights. So I'm hoping she has this one, the Target Light 2, because this one has the red and the near infrared in it. Okay, and the red is good for any kind of benefits on the outside of your body, like the skin, the eyes, the hair, the nails. But the near infrared light is what's going to be good for you, for your sciatica, for the pain, for the inflammation around that nerve there. So what I would recommend doing is when you have pain and you're using red light therapy, you want to get the light very, very close to your skin, So what I do is I actually touch the light directly on the skin. I'm dealing with some finger pain right now, and I just sit at my table, I rest the light on my hand, and I play on my phone, do whatever I'm doing. And that's the best way to get red light therapy for pain, because you want the light to penetrate as deep as possible into the painful area, into the bones, into the joints, into the nerves. You want it to go deep, and for the depth, you need that direct skin contact. For eyes and skin, it can be much further away because you only want that gentle treatment. And for the diabetes, diabetes is so complex, so it depends kind of what angle you're trying to treat. It's definitely fantastic for healing. It can be very good for the pancreas. If you can shine it over your abdomen, all around your body. It can help your eyes as well. It can help with blood flow. It can actually help with the glucose response, apparently. So it's definitely good for diabetes. But of course, diabetes is, massive. It's all around your metabolism and your diet. So, I know my mother's got diabetes and she's still stuck, in the time period of when she actually got her diagnosis. But we know now that if you drastically reduce your carbs and the amount of processed food you're eating, the amount of sugar, sodas, cakes, if you're eating any of that, if you massively reduce that, your blood sugar will rebalance, unless you've got type 1 diabetes, that's a different story. But most, these days, most people a lot of people are suffering with type 2 diabetes, and you can control that with your diet. So it's useful to think about that, to learn a little bit about, what it means to have a low carb diet and to try and reduce your blood sugar that way, try and control your blood sugar. Oh, there's a fantastic little message from Jules on Instagram. Jules says, this year I've been using it for S.A.D. First time since I moved to the Netherlands. She's been there 5 years. First time that I don't get depression because of the darkness and the weather. That's amazing. So that's a great little question there. Well, it's not really a question, but it is a question we get a lot. Does red light therapy help for S.A.D, seasonal affective disorder, and depression? And the answer is absolutely yes. It's a combination. So the first one is the brightness of the light. When you're in the northern hemisphere, you're in winter, it's dark around very often, and this can actually bring your mood down, and it can really contribute to the depression and things like that. So the bright light really helps lift your mood, but the red light therapy is a big aspect as well. So it really can help your hormones produce the correct happy hormones in the more optimal balance. So it's a great weapon to use if you're in the Northern Hemisphere and you're suffering from S.A.D. Absolutely. Joyce is asking, how long would you use red light therapy on sinuses? I would do, if you had a light like this, Joyce, I would probably do, I can't get it with my glasses on right now, but I would do it right on the nose like that. I would do about 5 minutes. I think that'll be absolutely perfect. You can keep your eyes closed because it is going to be quite close to your eyes. But if you aim it away from your eyes and towards your nose, you can even go the cheeks. You can go either side of the cheeks. You could even go on the ears, because obviously the sinuses are all connected here. So any way you can get light in, I think is going to be beneficial. If you're going to do multiple spots, I would say 2 minutes, 2 minutes, 2 minutes, something like that, and do it every other day, perhaps. I think you'll get, I certainly get fantastic results instantly because it reduces the inflammation. I get sometimes if I eat, the wrong food, if I eat dairy or whatever, I can get some inflammation in my nose, and the red light therapy reduces that straight away. Joyce, let me know if that answers your question. I take immune suppressor medicine. Is it true red light is not recommended? Gosh, I can't comment on things like that, So if your doctor is giving you some immune suppressing medicine, I can't, say anything against your doctor. I'm not a medical expert, and it's not something I've looked into personally, Jack. So I'm sorry, but you are going to have to, maybe have a quick Google, like Google your specific medication and red light therapy, see if there's any studies that have been done, see if anything comes up, then ask your doctor, and let us know what they say. But, we can't interfere with medical prescriptions, I'm afraid. Okay. Another glaucoma question. I have developed normal tension glaucoma and use red light therapy on my body. I sit with my back to it. The effect seems to be positive effect on bringing my energy down, clearing my head and eyes. I am too anxious to face the light, although the suggestion is not to look directly at the lamp. Am I missing an opportunity? Should I face and look away? Yeah, I mean, look, when someone's got some kind of if you're anxious about looking at the light, I don't know if it's kind of like emotional anxiety or if it's anxiety around you're worried that it's going to be dangerous for your eyes. There's nothing to worry about. It's been studied extensively with eyes, and there's no negative side effects with red light therapy in the eyes besides the brightness. So when people are treating their face, despite what I just said to Joyce about the nose, you can treat obviously very close up on your face, underneath and up on your head, away from your eyes. But any bright light in your eyes is not a good idea. And this is obvious for most of us. You go out in the sun, oh, the sun's terribly bright. You look away, you put your shades on or whatever. It's for any bright light. When you're driving at night and the car's headlight comes towards you, you know that feeling of what a bright light feels like. It's the same with red light therapy. So as long as you can face the light in whatever position you need to, that brightness isn't a problem, but you can still get red light in your eyes, it's very, very good for you. Red light therapy is really great for anxiety. I mean, Chris is, I don't know if it's Chrissy or Chris, but Chris is saying that it has a positive effect on bringing down her energy and clearing her head and eyes. And that's exactly what it's going to do. So even if you turn around and face it, I would argue that you're going to get even more benefits. So, if you're not too uncomfortable, start with the light on the other side of the room if you need to, and just sit and just let the light cover you. Slowly move closer to it until you get comfortable with it. You can get nice and close. But it's absolutely perfect to use it like that. Instagram, Gladys is saying she's read 2 contradictory versions about red light therapy for the eyes. That might have been us publishing contradictory information. It's not that it's contradictory, it's that as we learn more, as we hear more, as we test more, we have new ideas and we have new recommendations. So the current recommendation, which is the most up-to-date in alignment with the science that we're aware of, is 3 to 5 minutes a day, yes. But you can do 5 minutes and you can do every day. or you can do 2 days, 3 days, 4 days. You know, the thing with the scientific studies in red light therapy is that sometimes they'll do a study where they'll treat a person 3 times over 3 weeks, and they'll get fantastic results. Another study, they'll test them 3 times in 1 day and get fantastic results. So, you know, it's my opinion that at this stage, everything seems to be working, you know, within reason, you know. So we know that very low power and very low frequency treatments give great results. Higher power, lower frequency, great results. Higher power, higher frequency, great results. Everything seems to be working. It's a bit crazy to say it like that, but everything seems to be working. So, you know, it's not necessary to do it every day. You know, if it can fit into your schedule, do it every day. You know, it's not only is it good for your eyes, it's good for your skin, it's good for your circadian rhythm, it's good for your mood, it's good for your energy levels. So, you know, especially in the winter in the northern hemisphere, definitely do it every day. You know, you're going to get so many benefits either way. When using the handheld red light 670 on your face, what length of time would you use and how far away? So again, with any of our devices, arm's length away, 3 to 5 minutes per session. Every day is perfect. And is there a stand you can use for these target lights? So we don't sell the stand, but as you can see, it is just a regular screw-in light bulb. And the favorite stand, my favorite stand that I've tested, I don't live in the UK anymore, but when I did live there, the stand that I tested, the best one that I found came from IKEA, and it's called the Tertial. And it's, as far as I know, that's still the best option. It's like a big kind of articulated thing that you clamp onto the side of a desk, and it can move and it can extend, it can do all sorts of cool things. And that's called the Tertial from IKEA. I find that one to be the best. I know people do use microphone stands of varying lengths. So you can try a microphone stand. And then, of course, any lamp shop or Amazon or anything like that, I recommend going in and testing it, taking your bulb in and screwing it in and seeing if it can hold it up and it can get the angles you want. But the stands definitely are available. Jules says, what is the recommendation for collagen production versus aging for both skin and joints? Well, aging, I guess so you're referring to a skin treatment, I guess. For skin, it's again, it's about arm's length away. Anything on the face, I recommend about arm's length away. The reason being is because your skin obviously is on the outside of your body, your eyes are on the outside of your body, so you need very gentle treatments. These lights are very, very powerful, so you don't need to be super close up for that skin treatment, the beauty treatment. So arm's length away, which is roughly 65 centimeters, but anywhere between 40 and 65 centimeters is going to be fine. So, you know, that's probably about that distance, if that makes sense, and further away. When it comes to joints, now joints is when you want to be really, really close, because you want the light to go into your body. You want to make sure it penetrates deeply into your body, to get that near infrared light into the bones, around the cartilage, into the fluid there, into the muscles. So it's kind of different. I hope that makes sense, Jules. It's about 5 minutes per treatment as well. Whether it's the face or whether it's the joints, it's about 5 minutes. You can do 6 or 7. It's, you know, it's not a deal breaker, but 5 is just a nice handy number. So this question, what about, I'm not sure if it's creepy or crappy skin due to weight loss. I guess you're referring to loose skin. I haven't read much into this, to be honest, but it would definitely be good for the skin. You know, I mean, it is good for the skin, but I'm not sure what effect it would have on loose skin. Depends how loose your skin is. What it does is it stimulates collagen production under the skin. And when you have more collagen under your skin kind of gets a little bit tighter. So the collagen fills in the fine lines and the wrinkles, and it starts to plump it up, and it kind of starts to stretch out the skin and tighten it up. So you will get some benefit from using it for loose skin. But, you know, when you say rapid weight loss, I'm imagining like a lot of skin, you know, perhaps it's not going to do much to a lot of skin. You know, it does it for like loose skin around the face and the jaw. I have heard of great results, but for a serious amount of skin, you know, it might not be the best. But what I have heard is very good for that kind of thing is a lot of fasting and also a relatively strict carnivore diet. Because when you fast, I'm not sure if you know about this, but I'm going to tell you anyway. When you fast, what happens is that your body, when you go for many hours without food, your body will start to heal and repair itself. And some people say that it will start to eat itself, which sounds negative, but it's not. So what your body will do is it'll start to break down all the damaged cells inside your body, all the damaged little bits and bobs that's floating around. It'll start to break them down, recycle them, and get rid of the waste products. So I've heard amazing stories with people that have got a lot of excess skin that fasting helped to kind of, that's weird, like bring that skin back. And same with the carnivore diet. You know, if you're eating very, very high protein, it can actually, start to rebuild the muscle and the tissue around your body, and that can bring some pretty interesting results. So if you haven't already tried that, or maybe you have the rapid weight loss due to the fasting, I'm not sure, but it's definitely worth looking into. Okay, can I use the PainGo Pad for eyes? Unfortunately, not. The PainGo Pad is designed specifically for pain. It's our flexible wraparound pad. It's designed to go around the joints, around the muscles, and to go deep into the body and help with the pain. I do not recommend it wrapping it around your eyes. You can wrap around your face if you have jaw pain or headaches, but eyes, unfortunately, it's not recommended. Is the near infrared lamp better for glaucoma? I don't think we're able to say which one's better. We know they both work. Most of the studies use red light, but there's a lot of great studies that use near infrared light. So what I do and what I recommend is just to use both. So if you've got one of these, Joyce, you can use the combination of red and near infrared. Again, it's just the distance, and you will get fantastic results for your eyes. Okay, guys, I think that's it. Last call for any questions. Thanks so much for joining, everyone. This does go up on YouTube afterwards, by the way, well, in a few days, so you can always come back and check it out. But that's it, guys. Thank you so much for tuning in. Keep an eye on our social media and our emails. If you're in the email group, we will send out regular emails when these Q&As are happening. But for now, thank you so much, guys. Take care.